Hi everyone, my name is Tegan Ewart and I will be discussing my RN to BSN portfolio for Nebraska Methodist College of Nursing. I'll let you kind of take a look at my table of contents here as I talk about my topic that I chose during our capstone class. I chose homelessness in Omaha. I chose this because I'm a nurse in the ICU and I see a high number of homeless patients. And I feel really connected with this topic because I really struggle with just sending these patients back to the streets or back to the shelters every time we discharge, and I'm curious what's being done and what I could be doing differently to help the movement. So my first reflection that I'm going to talk about is my change agent level 3, creating a voice for self and others. So my story here, I was getting a patient from the emergency room. She was a meth user, and I was really dreading it because I had had a meth user before, and they can be really difficult patients to take care of. She was being admitted for sepsis. She went down for a few scans, and then she was admitted up to me, and I was told she's looking for a high before she withdraws. I was told this over and over again. She came up to me, she was crying, she explained to the nurses downstairs that she was in all this pain and they refused to give her anything. I looked into her scans and it showed that she was here for a kidney infection, and as the majority of you probably know, this is a really, really painful infection, and so I believed her pain. So we had to page the doctors 3 different times. They kept telling me she's still looking for that high, etc. Finally, the 3rd time, I told them pretty aggressively I needed someone at the bedside. I told the patient she was going to have an open and honest conversation with the doctors. I encouraged her to speak up, advocate for herself, and she ended up getting the pain meds, that sort of thing. Fast forward about 7 weeks, the same patient was walking down the hallway because her mother had been admitted, and she came to me. I hardly recognized her, and she hugged me and she said, "Because of you, I've been cleaner because I've been learning to say no and speaking up for what I deserve." And I thought, I just was in awe. I didn't think I made that big of an impact. I just wanted my patient to be comfortable. I learned that every patient is definitely different. She wasn't like my typical meth addiction patient. I unknowingly brought out this voice that she had been yearning for and longing for and needed in order to stay clean. I have 12 hours to change a life, and that's what I kind of taught myself. I need to use those 12 hours to really find that change and not ignore what my patient is saying. I tied this in with homelessness because a lot of our homeless are brought in on accounts of drugs and alcohol, and we kind of just group them together, get in, get out, get them through the withdrawal, and move on with our shift. And I don't ever really bother asking the deep questions, and this story kind of makes me think, could my interest in their past or their problems be the ticket to them getting help or getting their voice heard? So I attached an artifact to this, just a reflection I wrote in another class. Reflective individual level 3. This one was routinely engaging in habits of inquiry. My story for this one, I had a 23-year-old girl who was being admitted to me for a GI bleed, and she was a Jehovah's Witness, and she did not consent to any blood. The doctors would not do any procedures because there would be probably an extensive blood loss, and they wouldn't be able to revive her. So she was doing okay. About 10 a.m., her blood pressure started to drop, but we just kind of kept an eye on her because we didn't see any signs of bleeding. And then 11:30, she had an absolutely massive bloody stool. We had ICU doctors, GI doctors, families, nurses, everybody was shouting, this girl was just losing blood. They were begging her to take blood. She and her family still declined. We gave her about 7 liters of fluid before the family just said it isn't working anymore, no more interventions were going to be done. And I sat with them as she drifted off and died. So I really did handle the situation well. I love sitting with families in those situations. I love being the one that holds their hand, etc. But in this case, when I look back on it, I did it with resentment and just disgust. I could not believe that a family would allow such a young proactive girl die when there's a basic healthcare intervention that could have saved her. So kind of a few months later, I started researching Jehovah's Witness when this story got brought back to me, and kind of just realized, why they did it, and was more at peace with it. It's one of those, you don't necessarily agree why they did it, but you're at peace with it and you can agree to disagree. This kind of tied me in with homelessness for a lot of different reasons, because I'm always usually guilty on judging really quickly that, why don't you just get help? Why don't you find a job? Why don't you try harder? And, this just taught me that I need to do my research. I need to be not so quick to judge and criticize, and I need to look further into why this person doesn't have a job, why this person is struggling to get help, etc. And then I submitted a research paper that I did. Okay, effective communicator, my final level 3, using Spanish or other international languages in academic and community settings. So this is one of my favorite stories. Miss Rosa, I used that name for my paper. She was an 86-year-old Hispanic lady, and I had the privilege of taking care of her around week 8 of a Spanish class that I was taking. So Rosa was admitted. She had a history of cancer. She was admitted with low blood pressure and abdominal pain. She had a son at the bedside that spoke minimal English, but we could communicate in English and he could translate, and that's kind of how the nurses had been speaking with them. And I just thought, it was a pretty easy day, and I asked him if he would kind of help me speak to her in Spanish and help me correct the Spanish that I spoke wrong. And oh my goodness, Rosa was just gleaming as I attempted my Spanish all day. She thought it was so fun that I was learning and that I was putting in the effort to speak to her that way. As I had left that night, I was back the next day, and she wasn't doing super amazing. And when I returned the next morning, they had decided to keep her comfortable instead of pursuing treatment. So before I left the room, as she sat with her family, she told me that I have made such an impact on her in such a short time. She never had a nurse put so much effort into communicating, and told me that her and her family would never forget me. And I really did not plan to make such an impact on this family. I just thought it would be fun to test my Spanish skills. And I learned that, putting their needs and her language and her culture as a priority really, really made the difference in that patient's care in the short time that she was in the hospital. So connecting this to my topic, making anything I don't normally do or don't normally make a priority is really intimidating to me when it's not comfortable or not normal. One of those things with the homeless is finding out why they're not getting help, why they're not taking care of themselves. Sometimes they can get really, really agitated and angry when we ask them those questions, and realizing that I might be able to make quite a huge impact if I stay persistent on those patients and I make them see how much I care and how much I really do want to know the whys between all of their issues. For my artifact, I submitted a Spanish assignment. Okay, so my first level 4 change agent, draw individuals and or organizations together for a common purpose. So this happened earlier this year. I joined in a committee called the Patient Experience Steering Committee, and we threw something that was called PECS Week. And the goal was to reflect on achievements that were made by staff, re-energize the desire of patient safety and positive experience, strengthen our team's commitment to providing practices, and just remind staff about the joy that they originally find in their jobs. So the problem was the week that we had this planned ended up being one of the first really heavy weeks of COVID. And we decided to kind of go ahead with it even though tensions were high and people were kind of burned out. It ended up being the perfect week to do this. We had a mission Monday. We talked about it Tuesday. We highlighted patient experiences with staff. On Wednesday, we encouraged everyone to wear CHI gear. We had a thankful Thursday. Friday, we concluded the week by staff showing appreciation for their patients. It really opened my horizons to showing how important it is to take more than 1 week out of the year to celebrate our nurses and how much work our team does for each other. And I'm continuing to kind of evolve in my confidence to approach this between my coworkers and myself. Really tell people regularly that they're appreciated, they're essential, and they're seen. So I connect this with the homeless because they deserve, more of my attention than getting them through whatever they're there for, through most likely their withdrawal, which is what we see most often. And Text Week kind of told me to continue to evolve on my learning. And the way I look at that in the homeless situation is to continue my research and to continue my drive to want to help the homeless, apart from the 12 to 24 hours for a shift that I get to take care of a homeless person. But what can I continue to do after that homeless person has discharged from the hospital? How can I continue to impact the Omaha homeless situation? So this PowerPoint kind of ties into, this is my artifact that I did for drawing individuals together. I did a PowerPoint for my capstone class that discussed my homelessness situation, and I talked about the history, the demographics, the homeless shelters that are here, what's being done to end homelessness currently in Omaha. I talked about some other cities that are combating homelessness and how they are doing. And then we talked about 3 different ways that other states are combating homelessness. So this was just one small step at looking at what kind of change I could make as a nurse in the homeless community, and broaden my horizons for the research that I could be doing to start to make a difference in my hospital itself. Okay, reflective individual level 4, routinely engage in habits of inquiry such as logic and critical thinking. So this was a pretty recent story. I work in the ICU, like I said, and I admitted a patient right at shift change who was diagnosed with cryptococcal meningitis, so it's a fungal meningitis. He had nuchorigidity. He actually was not intubated yet, but we intubated him, and I kind of left for the night. I kind of left for the night after we had gotten him settled, and the next morning I came back and I started my first assessment right away when I got there, and I noticed something wasn't right. The patient's pupils weren't reacting to my light. He wasn't coughing when I suctioned him. He had no response to pain. We ended up doing a emergency lumbar puncture, and his pressures, his intracranial pressures were really, really high. We did an MRI, and unfortunately his ICP, his intracranial pressure, had increased so rapidly that he had a tonsillar herniation on his MRI, and he was basically declared brain dead at that time. We ultimately ended up withdrawing care from the family at the bedside. And that's kind of, the story of the patient itself. When I had gotten on shift, the sedation was turned off, and he still was not having any response to pain. And the doctors were saying that, sedation was probably wearing off. I just did not believe that the 50 an hour of fentanyl that he was on was causing him to lose his reflexes. So I kept looking through the nights trying to connect the dots. I did a little bit of really quick research, and I called the resident, and I kept demanding that something wasn't right and that I think he had intracranial pressure. The resident kind of still pushed it off and said we would look at it in rounds. So I went ahead and called the fellow, and he came into the room immediately, and that's when we started doing the lumbar puncture. So it's not always been natural for me to find an answer myself. I I used to find myself heavily relying on the charge nurse, the doctor, or literally anyone other than myself to find the answer. And when I started training new nurses, I found that I needed to know the answer. And I kept telling them, find the answer, find the answer. And I realized I never did that myself. So a resident, a fellow attending could have made the same call, and experience doesn't really mean anything in this situation. But I think it's the importance of using second eyes, using your critical thinking, questioning your nursing staff. Unfortunately, none of it really saved the patient's outcome, and he ended up passing away. But I'm proud of myself for looking more into the situation and not allowing it to wait until rounds. I connect this because I've learned it's okay to not always know the answer, and we may never stop learning. We never stop researching, we never stop asking questions. That's the beauty of being a nurse. And I connected this to homelessness because I think it's important to keep asking the question, why is homelessness so prevalent? Why are we doing all these interventions? Why are all these groups in place? What's being done? What can we, the hospital, do in order to help keep pushing this? Because there has to be a reason that we're still seeing such a high number of homeless people in our community. And then I attached an artifact, a research paper here to talk about habits of inquiry. And my final level 4 reflection, effective communicator. Use appropriate oral and nonverbal skills in varied contexts. So this is again along the lines of the COVID issues. I had a patient who was here because of COVID. She was intubated, and when I took care of her, I was extubating her, and I grabbed a laptop an iPad in order to communicate with her, to explain to her what was going on, why she was in the hospital now that she was awake, how we were going to do the extubation, etc. And I can't imagine being, in a Hispanic hospital on a ventilator, fighting for your life, not knowing what's going on, and everyone around you is speaking a different language. So it was just something that I naturally felt like needed to be done. When we extubated her, she told me that she was terrified, but she was so thankful that I brought the translator in and that I took the time to explain to her what was going on rather than rushing through the motions. I kind of learned no more rushing my cares. I do this a lot, and a lot of our COVID patients are Hispanic patients, and we kind of get used to the bare minimal communication that we can do with these patients and use a lot of hand gestures. And I realized, that doesn't cut it. I signed up to be a nurse to provide dignity and respect for patients and their cultures and languages, and that's what I needed to do. Connecting this to my topic, a lot of what we were doing in this story was building trust with our patients by speaking to them in their language and helping them understand what was going on. And the same goes for the homeless community, building that trust, sitting down with them, talking to them, not rushing through cares, passing judgment, making them feel like I don't have time for them, but always making them a priority and making sure they know I want to take care of them. I want them to get better, and just so they feel like someone cares, because I know just from my experience of taking care of these patients, they don't have people like that outside of the hospital. We are the only ones that show some sort of caring attitude towards them, and it's important to make sure that they feel that way under my care. And I talked about a research paper regarding advertising and communication. And then I attached my resume. So I appreciate you guys listening to my stories and how I connected these to my capstone topic. It's really cool to look back and see how we can connect a lot of our nursing stories to pretty much anything that goes on in the regular world. So I'm excited to take what I learned from this portfolio and attach it to my nursing career.